Welcome, everyone. We're so glad you're here. Just going to wait one more minute for everyone to join in. Welcome, welcome. Well, to honor everyone's time, we'll get started. Good afternoon. On behalf of the WVU Center for Community Engagement, we are glad you are joining us for this Academic Community Engagement, or ACE, event. The ACE Development Series aims to increase the breadth and quality of academic community engagement at WVU. Our intentions are that through presentation and discussion, attendees of the ACE series will learn how to get started or enhance what they are already doing and connect to a network of peers and resources. Today's presentation is called Community Engagement and the Socio-Ecological Model. My name is Melissa Calabrese, and I am the Academic Community Engagement Coordinator with the Center for Community Engagement. I'm here with other members of the Center for Community Engagement, including Mason Arbogast. Mason, if you want to wave. He's our Civic and Volunteer Coordinator. We're here, all of us here together for the next 50 minutes to share some best practices, case studies, and ask questions about how we might be able to nurture inclusive and holistic ways of thinking, learning, and collaborating. I encourage you to engage in whatever way feels right to you, including using the chat and making use of the Zoom emojis. I know I love that little heart button. This conversation is recorded and will be shared with registered participants. And I'm just going to say, in terms of the flow today, to feel okay with some moments of quiet. There may be moments that we're reflecting, which is a really important part of this process, and recognizing that each of our positions and relationships are all part of a healthy ecosystem within our community, and that our growth is unique to us. So it's okay if we have a pause in this conversation to think about how what we're sharing is resonating before another question is asked. One of our recognized WVU community engaged scholars, Dr. Elizabeth Clayton, is our moderator today. Elizabeth Clayton is an assistant professor in the Department of Social and Behavior Sciences, where she teaches a variety of undergraduate and graduate level courses, including designated service learning classes. She received a dual BA in Child Development and Medicine, Health, and Society from Vanderbilt, which started her interest in public health. She then pursued an MPH and Master of Science at Yale, focusing her research on obesity and eating disorder prevention. Dr. Clayton received her doctorate here in Social and Behavioral Sciences from West Virginia University. Her dissertation work focused on preventing the intergenerational transmission of eating disorders and dieting behavior in both community and clinical populations. Her research also involved the qualitative piece of the intersection between pregnancy and eating disorders. She's continuing this research agenda by educating healthcare professionals on eating disorders and weight stigma. Dr. Clayton is also researching the intersection between intimate partner violence and eating disorders. Elizabeth, thank you for moderating our conversation today.
Thank you so much for such a wonderful introduction, Melissa. I really appreciate it. I'm going to introduce the rest of our panelists today, and I'm so excited to be part of this panel with so many wonderful educators and researchers. First, we have Cari Michaels, who is an extension educator in family development in the Department of Family Health and Wellbeing in the University of Minnesota Extension. Cari Michaels, MPH, is an extension educator there, and in this role, she works in partnership with leaders across campus and community organizations to promote mental well-being, resilience, and wellness for families and the people who serve them. She brings to her work a focus on public health approaches to mental well-being. Cari works collaboratively to create educational tools, promote interdisciplinary collaboration, and promote campus community engagement. She's involved with numerous projects that include the 40-Day Project, which promotes self-care, social connections, and mental well-being for birthing parents and the people who serve them during the 5-week postpartum period. Welcome, Cari. We also have Tony Michael, who is the Program Director in Family and Community Development at West Virginia University Extension. David Tony Michael is a dedicated West Virginia with a profound understanding of his state's unique challenges, and he is the program director of this Family and Community Development program, and he embraces a vision of integrated programming and aims to strengthen the physical communities in every county by fostering collaboration and synergy among various extension programs. He believes that this holistic approach, akin to everyone paddling a rowboat in unison, will bring about comprehensive positive change. Drawing from his background in labor studies, business management, and prior roles in community economic development, Tony is well prepared to unite diverse programs to improve the lives and livelihoods of West Virginians. His unwavering pride for his state and its people is at the core of his mission, underpinning his commitment to tackling the challenges faced by individual communities and the state as a whole. With his extensive educational background, including a Juris Doctor degree from WVU, Tony and his team make a significant impact on the well-being of individuals, towns, counties, and West Virginia as a whole. Welcome, Tony. And then we also have Christiaan Abildso, who is an associate professor in the Department of Social and Behavioral Sciences. His research interests include health promotion, program evaluation, and social ecological determinants of physical activity, including policy and the built environment. Dr. Abildso has multiple peer-reviewed publications about Morgantown area rail trails, health impact assessment, physical activity planning, and evaluation of state-level health promotion programming. Christiaan is also active in local and state active transportation policy decisions, pedestrian and bicyclist safety, and national research on physical activity in rural areas. Recent work focused on physical activity in rural areas includes co-leading the Rural Work Group of Physical Activity Policy Research and Evaluation Network, and serving as lead author of a manuscript about the environmental determinants of physical activity in rural U.S. counties. He's also active in local and state active transportation, policy decisions, pedestrian and bicyclist safety, and national research. Welcome, Christiaan. All right, welcome to all the panelists. Again, we're so excited to have you here. And I'm going to start with a broad question that helps begin our conversation today. So this question is, how have you used a socio-ecological approach in your community partnership work, and how did it strengthen the outcomes of this work? And I'll turn to you, Cari, first to provide an answer to that.
Sure. Thank you, Elizabeth. It's really good to be here. My work focuses mostly on mental health and well-being. So I use the socio-ecological model first in teaching about mental health and well-being. Too often we over-focus on individuals' mental health and illness, and that really wrongly emphasizes only individual risk and protective factors. And it puts a huge responsibility on individual people to manage mental health when many of the risks are well beyond them, related to their living conditions, risk factors in community, family, policy, society, all those other levels of the model. So when we use the socio-ecological model in teaching, participants begin to understand all the ways they can improve mental health for whole communities, not just individuals. They can also see more clearly how they fit in the work. Lots of times we jump to the conclusion that this is about treating mental illness, and then people don't get it, or they don't understand why some of us are engaged in this work. But using the model helps people see we all have a role to play in promoting mental well-being. It's not just, a clinician's role to treat mental illness, it's everybody. Some of us work directly with youth, some promote family stability, some help communities understand and grow their strengths, some help change policies. Teaching with this model helps people make an immediate cognitive shift in how they understand all the influences of mental well-being. And I think it begins to, in my experience, it begins to reduce stigma and open the conversation. It's not about people who are sick, people who are well, it's about all of us. So that's the main way. I also use the model in research. Currently, I'm engaged in a research project with our School of Public Health here at the University of Minnesota and our Minnesota Department of Health, where we created a mental health and well-being socio-ecological model. It identifies risks at all levels of the model to an individual's mental well-being. It's being used in classrooms where students learn to view mental health from this broad perspective, and we start teaching differently about it. And they also learn to apply their research in their practice, whatever their practice is. And the current phase that we're in right now is about the societal level risk factors on individual mental health. So we're really specifically going through each level and examining, okay, what here affects people's mental health and wellness. Thank you, Melissa, for sharing the link. I was just going to do that. So those are two main ways. We have a couple of other things too. We have research reports that are collaboratively written by practitioners and researchers, and we use the model to explain the experiences of children's mental health issues from a socio-ecological perspective. I can put that link in the chat as well. And then we have online curricula where we also teach providers, how do you use a big socio-ecological approach when you have one child in one case study? So I'll put those links in the chat.
Thank you so much, Cari. It's really interesting to sort of see that model and also to think about how that interconnectedness can also reduce some stigma around individual choices or decisions or individual mental health, and think about it more as a systemic community issue. Christiaan or Tony, do you have anything to add to that or your own experiences in this?
So I think maybe to add to that is just a recognition. We just recently had our Family and Consumer Sciences National Conference, right? It's our overarching professional organization, one of 4 key ones in the Extension service. What I would say about it is one of the things that we had a discussion about there is, I'll put this in the chat, but Extension, made a commitment several years ago, developed a program action team that actually worked through this, and they developed this framework for health equity and well-being. One of the questions that was posed to the leaders at this most recent conference was, where should we be spending most of our time, and where are we spending most of our time? And the recognition was that we know that environmental change, right, and then policy change is what leads to better outcomes. The challenge we have is getting to those levels because so much of our interaction is with individuals, right? It's actually how we're designed. It's what's incentivized. It's what we're expected to do through our teaching, research, and service profiles. So because we know that, right, there's this disconnect between what we know is effective and what we're actually able to achieve. And so one of the things that we're trying to determine is what is the best approach to integrate what we realize are the opportunities with those challenges. As an example, I shared with the other panelists that right now we're in Huntington, West Virginia. A colleague and I are engaged in cultural competency programming under our diversity programming umbrella. Right? This is something where we know that diversity, equity, inclusion, and justice needs policy and community support for it to be effective. So often, and you heard Cari talk about the stigma that's attached to individuals for their choices, right? We also recognize that so often individuals are blamed for their situations. Just take microaggressions, for instance. Microaggressions are a problem because individuals are just too sensitive. Well, that is the dominant cultural position, not the reality for the individuals that actually experience this. So we're trying to create these connections to help the community understand the impact that the community's actions have on individuals, but then also help build resilience for individuals to be able to help influence, community change. So just a couple of quick examples under the health equity framework and our cultural competency framework of how we're trying to really integrate these two, because we know that the best outcomes are when we are able to reach individuals, but we're able to influence, right, communities and organizations.
Thank you so much for those great examples. And I think it's just so important to think about the environmental and policy levels and how difficult it is to reach them, but how imperative it is too. Christiaan, what do you have to add to that socio-ecological approach in your community partnership work?
Yeah, thanks, Elizabeth. Thanks. Yeah, I don't have too much to add, just in a way that I apply it, I think. And it's nice to have some colleagues out there and current students and others who may have experienced this, but in all that we do, all that I do in teaching program evaluation, many moons ago in public health, it was just dump a bunch of education into someone's brain, walk away, and of course they'll change their behavior, right? Well, we started to realize, and I think through Larry Green and others' work back in the 60s, 70s, and 80s that, wagging your finger at someone and telling them to change behavior won't work, right? It's not sticky. It won't stay around. So inherently in what we do, and in the program evaluation class that I've taught, almost 10 years now, we go out, we actually work with a client out in the community, like the United Way, the land trusts, folks doing vaccine work, Active Southern West Virginia, many that are not just educating and teaching individuals how to change a behavior, but looking at the structures, the policies, the big P policies, state, federal, but also organizational policies that can lead to environments that enable the healthy choice. They don't just tell people, it's not choice driven. So they're enabling the choice. And so that's, for the folks that know it, Larry Green's old, Green and Kreuter, the old reference in public health to the precede proceed model. It's worn and dated like a nice pair of jeans, but it's been around a long time and it's changed a bit over the years, but that is inherently ecological and social ecological in that it brings in the individual, social structures, and then the physical environments that people bump into every day, and also the many levels of policy as well, national, state, and local. So that's kind of where we are. I can talk a little bit later, I think, about kind of the physical activity work. And but it's really cool to be here. So yeah, thank you.
Thank you. Yeah, I really like the contributions of having that community partner with the class and really being able to have the students see the real world application of that in process. So thank you so much. And now we're going to go to a question that Tony touched on just a minute ago. So I want to go back to him to start the conversation about this. So which level do you feel is most effective to contribute to based on the work you do? And I know you mentioned a little bit about you see best outcomes from environmental and policy decisions. So I just want to hear a little bit more about your perspective on that, Tony.
Yeah, thanks. And I apologize if I skipped ahead with my previous answer. So for us, and when I say us, maybe to clarify my role just a little bit, on the one hand, I do have direct sort of engagement responsibilities, if you will, with teaching, research, and service as a faculty member, but I'm also an administrator, which means that I have a responsibility to help our other faculty in family community development be able to make these connections and do their work. So organizational connections is where we actually see the most benefit from our work. It's not that we don't recognize that those higher level changes would really make the most difference. But on the individual level, we're not really reaching the organizations, right? We're reaching individuals. And what we've seen happen time and time again is that individuals receive whatever programming we have to offer. They may feel empowered, but then they go back to a community or a system where they no longer have, right, people around them that are supportive, that are encouraging, that help them, navigate, the space. They're back into those old environments. Whenever we do a program like Dining with Diabetes, for instance, one of the reasons that we like having a group in that class is so that they have a cohort of people that are helping, hey, this is the way that we avoid serious problems from chronic disease and illness. These are the ways that we manage our A1Cs. These are the recipes that we can cook. But imagine, being the person who now is telling the family, no, we can't have that food, right? Or being the person that's surrounded by family members while you're trying to eat more healthy, for instance, and then they may be having the fried foods, the desserts, et cetera. It becomes a real challenge and barrier for them to continue positive behavior. So by working with organizations, we're kind of building in this infrastructure. And the organization can provide the framework, support system, even the expectation for the individuals to continue this positive behavior. And the hope would be that in the community, organization A has committed to this. Organization B sees the benefit, right? Whether it's the value that people are now placing on working at that particular organization A, whether it's the engagement, whether it's the reduction in absenteeism or whatever may be the case, because absenteeism may be health related, but it could also be mental health related. It could be because there are problems within the organization from a workforce perspective. So I think for us, what we're finding really is that connecting with the organizations, gaining that key organizational partner within the community is the biggest step that we can take, at least initially, because then we can build upon that.
Thank you. That's a really great perspective. And I like that sort of organizational, tie-in and how we navigate those. Christiaan, do you have something to add based on, what level you most intervene with and what you find most effective?
Yeah, I often talk with, it's fun because we do a lot in the built environment and physical activity and how we can enable healthy behaviors every day. And I have a lot of conversations with transportation officials and highways workers, and they say, and I'd hear, we don't have anything to do with physical activity or public health. And I said, well, every bit of concrete is a great intervention, right? And where you decide to put your asphalt matters, right? Can you, like folks in Morgantown, can you imagine Morgantown without the rail trails? It's hard to, where's the flat place to run where you're not going to be dodging cars, right? Or go for a walk, or maybe go get a bit of ice cream or something good. So what's interesting in what Tony was talking about as well, I'm going back to my old grad school days working with individuals in a health ed program, right? In a weight management program, talking about food and we run into these systems every day, right? Okay, we're educating, we're in a lab doing exercise. And I asked this one person about, at home. So a different environment, right? Totally different environment than your organizational or workplace environment. And the person said, well, I make myself a meal, but my child is super picky. So I have to make him a meal. And then my husband, he won't eat the stuff that I eat. So I got to make him a meal. And then another one. And so it's like this person's making 3 different meals every night. Totally not sustainable, won't stick, right? So it's understanding those environments that really matters. And even in the research from that weight management program, we found one of the big predictors of weight loss was the neighborhood supports for physical activity. And it was nothing about the program itself. So win. All right. So all these things they stack on one another, right? And create healthy environments and support, healthy behaviors.
Thank you. And I think that example with Morgantown is very apt. We really have nowhere to run that's flat except for the rail trail. So I think that idea of, even small changes can be really meaningful. So Cari, what do you have to add on this?
Yeah, thank you. As an educator, actually using the model as a whole is what's most effective for me when I teach. Emphasizing the relationships between risk and protective factors at different levels is the most eye-opening for people in my experience. So for example, when people learn about how societal discrimination affects individual mental health help seeking, which then influences mental health outcomes, they're left with a much clearer understanding of why people struggle and why more people in certain communities struggle. And when people learn how social connections are part of the definition of mental health, we recover, we heal through relationships. They see what they can do to improve people's mental health. That's a tangible thing. We can help people connect with one another. And a lot of people forget about the importance of relationships. So that said, I also love to work with community cultural groups to different racial and ethnic cultural groups, but different populations. Students, I work with the 40-day project that we mentioned earlier, focuses on immigrant parents during the postpartum period, Somali parents and Latina parents. I love to work with them to examine what our definitions are about mental health and mental illness, where they came from, what we learned as children. Do those messages support our health or prevent our health? if we can start to pick apart the harmful messages that are ingrained in our communities, then we can make a difference. So I do love working at that community level as well.
Great, thank you. I think it's really, fascinating to sort of I understand this idea of the socio-ecological model with not change doesn't happen in a vacuum. And so I like how you, holistically show that when you teach and when you engage, but that community work is also so critical to understand sort of people's ideas about health and how that shapes their health behaviors too. So our next question looks at some of the interconnectedness within this model. So how do you account for cascade effects at higher levels that may affect the work you do, such as policy decisions that may influence your ability to impact community change? So I'm going to throw this to Christiaan first.
Yeah, thanks. I mean, one of the really big levers you can pull, right, is policy change, and the superpower is interpreting that policy, right, the Supreme Court and other things. So we see that all the time. And in some of my volunteer, service work for the university, I do, engage in pedestrian safety boards, metropolitan planning organizations, which they actually structure these like 20 to 30-year plans of how hundreds of millions of dollars in transportation money will be spent. And you can see how people pull the levers to prioritize certain projects over others. For those in Morgantown, there could be a new $80 million bridge because certain people want it over the river. And that's because they changed kind of the priorities after the fact and things like that. So there are definitely some high, and I'm using systems level kind of language about the levers that you pull to make things change over time. And so comprehensive plans, these are, wonky terms, from city planning and transportation planning. Those things stick around for 10, 20 years and impact future generations. So I mean, it's seductive to do like health ed and see someone in the moment change their behaviors, right, for a week or two. But this stuff takes 10 years, 15 years before you see, a curb cut or a crosswalk or something. But so those things definitely stick around for a long time. And oftentimes it's because of federal highways policy and who's in charge of the government, federal government, and the interpretation at state and local levels. So there are tremendous cascade effects, at least in the world, that I work in, especially in physical activity. So yeah, I appreciate that.
Thank you. And yeah, it's interesting to think about the levers and what people choose to prioritize and how that can impact health for an entire community for years to come. Tony, what are your thoughts on those cascade effects?
Well, they can be positive or negative, right? I mean, that's the reality, is that, I would love to say that, I've only had positive experiences, but we've certainly had the alternate happen where, for whatever reasons, sometimes it's budgetary, right, where they are making decisions at a higher level that ultimately limit our ability to make any kind of significant change. When a community makes the decision of where its money is going to go, right? And we know that limited resources, if they're not going to build the walking trail, right, because they're going to make this downtown investment, the downtown investment, if it works, great. But how many times do investments not work out? Or is that, and I'm not talking just about return on investment, but sometimes we're incentivizing the wrong things. I look at, we'll extrapolate to our state level, now. 100%, I believe that you need to be thinking about ways to recruit businesses to local communities. But what are you giving up in order to do that? And what do you think, or you're including the citizens in those considerations? And that's often what's not happening. Most recently in workforce development, just recently was having a conversation with some leaders in workforce development education. And during that discussion, I asked a simple question, which is, it seems to me that there is a disconnect between the services that you all can provide, which is educating the workforce, and the employers and the state recognizing what workforce education is needed. And they said, yeah, we're not being included in any of those discussions. That's a problem, right? But there are other times where you get a community who's very forward thinking, may look at the data and really consider communicating with experts about if they want to see a healthier community, what are the ways that they can create this interconnectedness? Walkability of a downtown, for instance. You know, how many places, you know, here we are, you know, those of you in Morgantown, if you've maybe seen the mile ground get sort of completely redone after what, 10 years. There are now sidewalks up there. You still have that gap. You can walk on a sidewalk on the mile ground. You can walk on a sidewalk downtown. How do you get from the mile ground to downtown if you're walking? You're still walking. I've walked it before. You're walking through grass. You're walking on the berm of the road. So, you know, I really believe that the cascade effects are significant, and they can be significantly positive or significantly negative. And one of the things that can help, going back to this organizational consideration, organizations can actually help make that positive change. If the upper level considerations aren't to your favor, how can local organizations perhaps get grants? How can you support them to get grants to start to influence some of that change until maybe there are leaders who are willing to listen, or there's enough community support to influence the leaders to listen?
Thank you, Tony. I think it's really important to acknowledge that these cascade effects can be positive or negative. And I like how you brought up that we can mitigate that harm, even if there are negative effects coming down, by those organizational structures that can try to help make positive change in the community. Cari, what are your thoughts on these cascade effects?
Yeah, I would love to just second everything you said, Tony. Yes, positive and negative effects all the way down. I will just give two examples of ways in which I think we're trying to work against some of the negative effects. One is through that 40-day project. We have policies in this country that don't support new parents during the postpartum period. Back to work is a huge issue. And there are also a lot of people, immigrant parents here, who had a lot more support in their home countries. So our motivation for this work really was because we were learning about research where grandparents didn't understand the struggles of their daughters who were birthing babies in this country. They had been in Somalia, for example, but this is applicable in many, many other countries. And there was a 40-day rest period, and you had family and friends, and they came and took care of your cooking and cleaning and childcare. And you were there. Your job was to rest and to be with your baby. And so here, it's a whole different thing, and often a shock to parents. And then they're, if they have a partner that their partner might be going back to work in 2 weeks, they might be going back to work in 2 or 6 or something, but rarely is there time for rest and relaxation after the birth of a baby, which is pretty significant. So we are attempting to bridge that gap through this project and through not only providing education, but support. So we will gather Somali parents and provide some more social connections for them, teach about the experiences people go through during the postpartum period, connect people socially, connect them to resources. So we're recognizing that we're not exactly in a position to change workplace policy around returning to work after so many weeks of leave, but we can try to institute some of the cultural practices that people had been used to in their home countries. So that's one. The other thing too is not that I think that we should accept all the conditions that we might experience, but I also teach a lot about self-care and people's window of tolerance. What does that mean? Because there are things that are out of our control. I think that as extension professionals, it's also part of my job to make change at each of those levels. But I also, especially since COVID, have found there's a huge need for people to know that window of tolerance is a thing. I can learn about how to regulate myself in the midst of adversity. I'm not accepting that discrimination is right. It's clearly wrong, but I also need to regulate myself in order to parent, in order to work, in order to do all the other things that I need to do in my life. So how do you take care of yourself in the midst of the things that you can't control is another part of my work.
Thank you. Another excellent example of sort of how we mitigate that harm, but also acknowledge that, we want to change these larger systemic issues, and we can change them to the degree we can, but we need to be able to, work on self-care or work on other strategies to improve the lives of the individuals around us and ourselves too.
And Elizabeth, if I could, I wanted to add one thing that Tony and Cari are hitting on, and that is that the goal or the paradigm drives the system. Think about Bhutan, that has a national happiness index or a gross happiness index that rewards that. And the US has a gross domestic product that encourages us to buy and consume and throw away, right? So it's that kind of lever that can really drive things. Sorry to interrupt, Elizabeth. You can smack me when you get into work.
Please feel
when
free
when I see you in the hall.
Yeah. No, please feel free to interject if there's some point that you want to make. I think that's a really, really important thing to consider is, where we place our values determine how we work towards different aspects. Our country is very financially based, and it's, that consumerism, whereas other countries focus on happiness and mental health and mental well-being. And so it's interesting to see how that cascade effect also influences what we work towards as a community and as individuals. This next question looks at how does the socio-ecological model change the way you think about behavioral change as an individual concept versus a more systemic approach? We've dealt with this in some capacity already, but I'd like to see if there are any other thoughts, and I'll just open up to any of you that want to, add to that.
So I'll take this from the administrator perspective, if you will. So, we've looked at this and we've seen, for lack of better terminology, recidivism, right? People who come back, right? Same problems, return, you help, same problems, return. And for instance, that Dining with Diabetes program, by recognizing, this, it really does help us think more intentionally about our work and how do we target these longer lasting changes. One of the things that recently, I would say over the last year at least, we have really been trying to hit home that funding is now tied more than ever to the outcomes. What can you show, right? What is the change that you can show? And we see this at the federal level. We see it, we're going to be seeing it at the state level, probably in higher education. So we really do try to help our faculty recognize this, because now we need to incentivize their work a little bit differently. It's not just about the numbers of people that you've trained. It's about the outcomes related to those numbers. You're better off in so many ways, again, working with those organizations so that you can report organizational change rather than saying, well, we reached 3 people, and 2 of those 3 had their A1Cs, go down. So I think for us, it is a way to encourage everyone, to think about these socio-ecological approaches, even with our communities. We have leaders who do not have the backgrounds that we do. It's just a fact. So helping them understand how this model can help them achieve change within their communities, I think is very beneficial too. I think more than ever, again, we've seen this happen where people in leadership positions might really want to do what's best for their communities, but they don't know how. So by giving them this framework, I think we're actually enabling them, or at least encouraging them to think about using this model and using the resources through extension, through WVU, higher education, through community partners. There are so many organizations that have similar interests to those that, many of us on this call today carry forward. It's in some respects for us to serve as that bridge so that the community leaders can really understand what's going to make positive change.
That's a wonderful point. And I think it's really interesting how we can use this as a framework to help others understand too. I see there's a question from Ann Jones. I'm gonna have her ask her question, then we'll get back to the other questions.
Hey, thanks. And I am with my role here at the university, I am definitely, this is so much out of my range of sort of understanding. So it's super exciting to listen to. But having worked in economic development and then here at the university, one of the things that I know that we need sometimes as professors is to have guidance in how to balance that. I know when I'm working on a grant, I'm working on a big veterans grant. That's like turning a battleship around, helping veteran entrepreneurs. I know we want to step away from just like, yeehaw, I coached 150 people this year. But at the same time, you know, I need to find ways to create some short-term goals that I can report back on without losing the sight that, you know, real success is going to be 5 years from now, minimum, when we have thriving businesses and communities with veteran entrepreneurs. So I think that's a challenge as someone who's like trying to do what you're doing, what you were saying about how to look at, you know, larger goals rather than individual goals. When the grants we're given, you know, aren't always set up for that.
Thank you. I really appreciate that. Any responses to that? How do you address you know, trying to make these broader changes when you're constrained sometimes by grant mechanisms or other means?
I'm just chuckling because can you change the grant mechanism, right? That's the big structure. But yeah, there's a lot to track before you get to the outcome. So we should talk about having, I have in the spring, I teach a program evaluation class where the students actually work with that community member, and and that's part of what we do is like, what are the intervention factors? What are the policies or the organizational structures that are getting in the way of you actually doing something that would benefit? You know, it's like, what's out here? What are you doing here? What's in the middle? And getting to what's in the middle and measuring that. Even if you don't report it, if they let you measure it, you can still report what they want, you know, the people dropping the money on you. So yeah, love to have you in class.
Excellent. Super, super exciting. Well, I think, you know, we may get this grant again. So I work in the launch lab. So, you know, we can turn this into a new innovation for my students. Everyone's a winner.
I think that's wonderful. It's exciting to see how we make these connections and try to address some of the needs that each other have.
Let me, Elizabeth, I apologize.
Yeah, absolutely. No, go ahead.
Just put in the chat something that many on this call might very well be familiar with. It's the extension logic models. You know, if you're not familiar with it, this could be a great framework or tool, right? It's easy it's not easy to develop necessarily, but once you develop it, it can actually really help you connect those short, medium, and long-term goals, and then think about what are the required inputs. And the goal here would be, as you move along the continuum, right, to revisit. You know, it's always possible to go back and revise a logic model, but without thinking about that ultimate end goal and then working backwards, sometimes we really are actually being a little less effective than we should be, because we may be addressing the immediacy, right? Because so many times, right, the RFP drops and it's like, okay, what do we have in place to address, you know, that request? So just sharing in case it does benefit someone.
I think that's an excellent resource. Thanks so much for sharing, Tony. Cari, do you have any comments to that question?
Yeah. I already talked about some of the things that I'm thinking about with respect to how does the model change, how we think about behavior and more systematic approaches. But what I think is most critical is the model helps open the conversation. There's a lot of stigma around mental health. It reduces that stigma pretty immediately because people begin to see, oh, wait, this isn't all on me. Look at all these other risks that we've got in our environment, or protective forces. So it helps people be more accepting of one another's struggle. I think too, in extension, we do all kinds of work that help families and communities. And at first, I've been doing mental well-being work for a long time, and at first people didn't get why we were doing it. And the model helps explain where everybody fits in. It explains why, if we're not doing mental health work, we're not going to be successful in our other areas of work. I would say, especially since the pandemic, just things shifted so dramatically, and the need for this kind of approach just shot up with people in isolation and fear and sickness and death. So my work really shifted at that time, and I think that using this model helps people see not only why they struggle, why other people struggle, but also how a lot of different types of work reflect in are part of promoting individual mental well-being. And we can work with organizations, we can work with communities, we can work with cultural groups, but it starts with having a conversation. And since that's a struggle, I think the model just slips in there really easily. So I use it all the time.
I think that's excellent. It's really interesting to see how, it helps broaden that conversation, helps people sort of see where they fit in, where their role can be to support this overarching goal, since everything is so interconnected. I want to ask another question just about how individuals narrow their focus while still using the socio-ecological model so they can have a better impact on one area rather than having a mediocre impact on several areas. Does anyone want to take that?
I'll say one thing. This is my struggle as well, so I don't have any crystal clear answers. I do think in some of our roles, at least in extension, we are constantly zooming in, zooming out, zooming in, zooming out, do a very specific, very tangible, very tasky sort of thing, strategize about the big picture. So I will say that using the model so regularly in my work does help me manage that need to zoom in and zoom out. I think too, though, we need to shift our organizational practices when it comes to engaging deeply with community and building relationships that take a lot of time. They just take more time than we have allowed ourselves. So I think that shift needs to happen too.
Thank you. Yeah, it's nice to be able to use it to zoom in and zoom out, but not try and do that all the time. And those community partnerships take a lot longer to build than we allow that time for, especially when we're thinking about grant mechanisms and things like that. Christiaan, do you have anything to add to this?
I don't think so. I just worry we're running out of time.
I know.
This is fun, but yeah.
Yeah. Melissa, do you want me to sort of wrap up and open it for any other questions?
Could I add to that real quick? I promise I'll be brief for once. So I think part of what benefits is finding like-minded people, even if they're out of state, because you need your own support network to be successful.
That was the only thing I was going to say. Get a bunch of people to help you, because you can't do all of it by yourself. Yeah.
Excellent. Yeah. And really like finding the people who are best suited for the different areas.
The different different areas. Yeah. Good.
Well, thank you all so much for answering these questions so eloquently and engaged in this conversation. I'm just going to open it up if there are any more last minute questions. I know we're very close to time, but I want to respect time, but also, if anyone has any burning questions.
I'll add that when you say finding like-minded people, and I think about all the work, although your work is different on this call, there's so much opportunity to elevate our communities. And I'm looking at our participant list, and I know this is a great networking opportunity. So if anybody wants to drop their email or follow up with a conversation, please do so in the chat, because this is just the beginning of a conversation, right? And we can do so much more together. So thank you all for being here today. Elizabeth, what a great job moderating. Thank you so much. And thanks to all of our participants for submitting questions ahead of time as well. We'll follow up with the recording as well as all the resources that were shared. And so please look forward to seeing that. And I think we have a little, well, we're about time. So if you have additional questions, you could put that in the chat as well. Yeah. Thanks all.
Thank you all so much.
Thanks.
Thanks, everyone.
Thank you.
Appreciate it. Great job, Elizabeth.